may get a little pop-up that says this is being recorded. So on behalf of the BC Brain Wellness Program, I'd like to welcome you to this workshop on emotion coaching. And our speaker today is Chantal Bourke. Chantal is a clinical counselor in private practice, and she came very highly recommended to me by a colleague. And after meeting with her, I was really quickly able to see why the recommendation was made. And I got to have a sneak peek at the slides. So I think we're in for a really, really valuable hour and a bit together. I certainly am really interested to hear more about emotion coaching today. And Martina, if you're able to pop her bio into the chat, that would be great. It is on the website as well. And with that, I'm going to turn it over to you, Chantal.
Okay, thank you so much for that really kind introduction. That was very gracious. Thank you. Hello, everyone. It's a privilege to be here and to be able to be speaking to you today. And so I'm very grateful for your ears and just being able to just share some space with you. And hopefully teach you a new skill or that you will walk away with something new today to take with you. I also want to just appreciate that care partner is a new term for me that I am not, that I was like, oh, okay, this is the term that is used more so now as opposed to caregiver. Is that correct, Elaine?
You know what? It's an interesting one. I've canvassed a lot of people. Some people don't like care partner because they don't feel it's a partnership. Other people
Sure.
do.
Okay.
Um, so it's just that territory.
Really cool. Okay, yeah, I wrote it down and I wanted to be really aware of that. So I appreciate that. So I'm here to support you all to learn some new skills around becoming your loved one's emotion coach. And so Elaine already gave me a really nice introduction, so I was like, I don't really need this slide anymore. But I'm a clinical therapist in North Vancouver on my private practice. I have over 10 years of experience with children, teens, and families in clinical hospital and treatments. EFFT is an emotion-focused family therapy, is how I came to learn and begin teaching and speaking about emotion coaching, is that it's a very big part of emotion-focused family therapy. And in my practice, I actively practice EFFT, EMDR, which is a trauma-based therapy, IFS, and client-centered therapy. So that's a little bit about what I do. I'm a mom of two boys. That also is always entertaining. I'm a parent myself, and as many of us have multiple relationships in our life, that is the one that takes up a large amount of space. So I just wanted to start with a little centering quote that to remind all of you just why you're here today and why you continue to do the things that you do, is to remember love is the compass that guides you through the challenges of complex care. Everybody is managing a different type of complex care. That's why I put it as that, as there are many different diagnoses and medical challenges that are coming with your loved one. And to remember why you're here and to access those places, that love is that compass for you. Now, I had reached out to Elaine a little bit to say, oh, is this okay to put in here? Because maybe they've heard enough about it. So I'm going to be very, very succinct in this because, yeah, I'm sure that all of you are very tired of listening to caregiver burnout because you're probably all in it and have been in it for a while. Why that I put this out here is because it is in beginning of this presentation to really grab onto some awareness about where we're at and awareness around what you're going through and the incredible weight that you are carrying with yourselves as you go through being a caregiver, care partner. We need to locate ourselves emotionally, physically, mentally before we even enter into the worlds of getting in a new skill that is involving a lot of emotion and emotion coaching. So just a quick definition, and maybe some of these things that you might want to that you can remember that are happening for you that are symptomologies of caregiver burnout, is that you might be easily irritated, exhausted all the time. Some people find themselves depressed and anxious, and those two are best friends. Depression, anxiety, they tend to go together. Sometimes we tend to avoid people because of exhaustion, or even because of just we're tired of caring, we're tired of listening, we're just exhausting, and so we move into isolation, we move into inside ourselves. We often have a loss of interest in life and activities. We just don't feel any motivation, we just don't feel any desire. And this isn't an exhaustive list, but it and other symptoms can be present, and it's a means of just really wanting to show the validation that of where you're at, that many of you probably ebb and flow in these areas. Sometimes you feel more robust in your caregiving, sometimes you might feel not as much, more depleted. And to remember that this is caregiver burnout is often supported, or is like addressed with like self-care, which is another like, oh, why am I talking about self-care? But just a couple of like little therapist kind of points, because therapists, that's what we like to do. But to recognize that the weight that you carry and how hard it is at times. So again, right? Please, not another self-care talk. My gosh. Well, the reason that I wanted to kind of have my little 2 cents here today about it is because I have a little bit of a different take on self-care. It's not about making the situation better. It's about staying above water. And self-care will not make you feel better necessarily, but it will help you stay at baseline and increase your resiliency. So there's a lot of dialogue out there, media things that we can consume, however you get your information, chats with people that you're connected to, but that think that, oh, if you just do this or go do this, like have a bath or go on a trip or buy yourself a book or do something for yourself, that in some way it's meant to make you feel better or make the situation better or less exhausted. Whereas oftentimes these things that are suggested to you actually feel more exhausting in of themselves. I have no space to do this. I don't have time to take care of myself. My loved one is 24/7. I live with them. I'm like, there are just too many things and too many pieces. And so putting yourself first in a situation it feels almost impossible to do that, feels too much of a heavy burden to do. That being said, if we can sometimes wrap our minds around the idea that it's to ensure that we don't sink with the ship, and so that our caregiving and our care partnering with our person can have longer spaces over time. It can increase your resiliency, which is your capacity to bounce back from adversity, is that we want to keep the stable boat going, even if it doesn't make you feel better. So getting out for that walk just by yourself, or having that coffee with a friend, that really going to groups like this where you feel heard or you're learning something new, or just sitting quietly and doing a puzzle that's just for yourself, or taking that trip with a friend or a loved one, whatever it looks like, to remind yourself that it's not meant to be this wonderful ooh kind of experience that's going to rejuvenate you. But ideally, what it's going to do is that it's going to keep you at baseline so that you can keep doing what you need to be doing in your life with your loved one. So that's my little take on self-care that I just want to get in there. um yeah, and then there are barriers to self-care, right? And this is my little therapist kind of thing, and the things that we kind of talked a little bit, right? Time. Caregiving requires an incredible amount of time. And the energy reserves required to do so. I imagine that many of you are probably feeling like you don't even know where you're digging from or finding the energy anymore of where am I finding this? It's incredible what humans can do. Demand. Demand is intense at times. You are dealing with not only a loved one and the full-time caregiving of a loved one at times, but also the demands of that illness or that diagnosis, or however you found yourselves to be in a care partnership. So there's also just the demand. And medical emergencies, also things that do pop up when falls happen, or sometimes in certain diseases, a new baseline hits and new needs are needing to be met and new things are needing to be considered. These take up a huge amount of time and space. Finances. We are all living in a very, very expensive province. We are living in an expensive city. The world is, I don't need to say much about what the state of the world is in, and that alone, and then the cost of care and what that means, and the decisions that you have to make, and that maybe you'd feel like you weren't the ones that you were planning for, how your finances were, or the things that you thought were going to happen are not happening, and you have to make really hard choices, and that can be very difficult. And then emotional blocks, which is why I'm here today to talk about, is the things that sometimes really get in our way. And so these are the things that we need to be aware of before we even start talking about emotions, because it's just about acknowledging where you're at and not even needing to necessarily change that. But there becomes great power and great autonomy and great relief when we just acknowledge where we are emotionally and say, yeah, I'm really having a hard day today, and this is why. And then often the emotion can go. But we need to accept and honor where we're at before we can even move into that. So these are some of these barriers that we do and that show up when it comes to self-care and caregiving. Okay, so yeah, I'm just going to lay it all out there, right? I'm just going to say, here are all the problems with self-care. And then of course, I'm going to give you a couple of things that you probably already heard before, but I guess it never hurts to have a little bit of repeat. I don't know if you've talked about the oxygen mask before. It's something that we talk about in EFFT. So I hear Elaine nodding, which is perfect. So yes, you know what that is. You got to take care of yourself before you take care of somebody else. I won't be redundant in that. So please remember to do that, even just a little reminder. Glimmers. I'm not too sure if you've ever heard of this term. It's something that comes out of the opposing idea of triggers. So triggers being when you're activated or something pokes at you and you have a big emotional response, or that triggered me. Glimmers are meant to be the counter to that, where it's to remind yourself, and even so, whether it's to remind yourself or to allow yourself those moments with your loved one to remember why you're caregiving for them, why you're there, whether it's a laugh that happened that you haven't laughed in a week together, whether it was that there was a change that you weren't expecting and that you both were able to sit in it and talk about it and share some real vulnerability together, whether it was a quiet night watching a movie together with no anger, with no resentment, whether it was joy that has not been seen or experienced, or even small noticings of things that you're doing while you're caregiving, is to remember that this is very, very difficult stuff. And yet, if we continue to focus only on the hard stuff, only on the triggers, we kind of forget why we're doing it. And so the glimmers that can show up in our relationships really help us keep moving forward into why we're there in them. So hang on to those glimmers. And you can even focus on the past ones too, that before like the loved one maybe got ill or before things happened, that remember, the wonderful parts of your relationships. A little bit of mindfulness. I'm not trained. I'm not a person that does a lot of mindfulness in my practice, even or even in myself. But I do recognize the power of the importance of just taking a breath and reminding yourself of just being in this moment, and focusing on breathing and breath work and one things, because it does help our nervous systems kind of regulate. So that is a really good thing. Expectations, I think, are a really wonderful thing to always look at and manage. We often have high expectations or low expectations, and somewhere in the middle is where we need to be at. But if we're expecting our loved one to do something that they're just not able to do, that often can lend us in frustration and resentment and anger. And so sometimes looking at ourselves and our own expectations can be really important. Am I expecting my loved one to do more than they can be able to do with their current state? Or am I thinking that they can't do something and they're frustrated because I'm thinking that they're not able to do something anymore that they actually really can do? And these are just really small examples. But sometimes just taking a moment and checking in with ourselves around our expectations, their expectations, and having a conversation about it, or even just acknowledging it, can really help our feelings that show up, and also managing our self-care. Oh, you know what? They can be left for an hour with this person, or they can watch TV for an hour while I just sit for a moment. You can take care of yourself. We just have to look at managing the expectations. And then long-term management and planning, that is not something that I could even begin to speak about in the scope. You have many people that I'm sure do in this world to support that, but also to remember that when we're in it, and in the moment of it, and in the moment of caregiving, it can be really hard to remember to continue to know that this is long term, so that we don't need to do everything all up front, always crazy, but that we can take our time over time, and we can just be slow about it at times too, because self-care, then you can put in more moments of self-care. So just a couple of things to remind you around that. And so here we are. The introduction to emotion coaching. It's the skill you didn't know you needed. So you get a therapist to come and talk to you. I guess we're going to talk about big feelings, right? And some of the things that before we even learn the skill or even before I introduce it, um, these are some of the top emotions that caregivers can experience. Emotions are wide and varied. There are many. There's a big wheel out there floating around the internet of all the different things that you can feel as a human can. We're very complex creatures. And yet, what I have noticed over the time and then the privilege of being able to speak to caregivers and care partners in these situations, these are the ones that I've noticed kind of pop up the most. And so I thought it would be good for us to take a moment to just recognize that this is what pops up and to acknowledge them, to validate them, and to be able to. Because the other thing that's really important is that we need to kind of recognize where we are at emotionally before we start engaging with our loved one. If we have an unrecognized emotional state, it often can get projected onto our loved one, onto our relationships, and we don't really recognize what's getting in the way of a skill, a task that needs to be completed, or emotional connection. It can often get in the way. So it's very powerful and very important for us to recognize the emotional state that we are in before we decide to engage in maybe more meaningful connections or more meaningful skill-based work, which is the emotion coaching. So grief is such a big one. The anticipated and or current loss of someone. In the world of caregiving, it can look so different because there can be grief that's coming with a diagnosis or a change in someone, whether it was a stroke or dementia or something, but we know now that this person that whether it's spouse or parent or child, it doesn't matter, but something in the relationship and the way that we thought that things were going to go have changed. And so there's already a grief right away that we're experiencing because we've lost something, we've lost a person in some way. And then there are illnesses and diagnoses that come with a gradual loss of a person over time, where they hit new baselines over time, and how we have to change that. And we're grieving the last stage and moving into the next one. And then for some of you, not all of you, but some of you, there's the actual grief of losing the actual physical person when that time comes. And there is something that called in our world, we call anticipatory grief, is that when we do know that there is a terminal illness, or we do understand that this is what this is going to look like, that we actually do start anticipating grieving them. We start looking at that. And grief is very interesting in its own right as an emotion, it's kind of in a house all by itself. I find it is like a bubble. It comes and goes, and there's no real rhyme or reason. You can be out for a walk and you were fine, and then all of a sudden you hear something or you smell something or something reminds you, and then you have this big wave of grief come up. It is a very unpredictable emotion. Shame. Interestingly enough, I added this in just recently as I got feedback from another group, and it was so important, and I was so glad that they brought that to my attention, because shame, there's a little bit of a difference, and not many people know, and I just learned it a couple of years ago, to be honest with you, around shame and guilt and what the difference is, because a lot of caregivers kind of show up and say, I feel really guilty. And I often will kind of offer some feedback and say, oh, is it guilt that you feel, or is it shame? So guilt is when we do something bad. So if I was to walk into Elaine's office and just go in there and take her coffee and just spill it off the desk, and she kind of looks at me, I would feel really guilty because I did something that wasn't nice and that crossed her boundary. And in all binaries, I did something bad. Shame is the belief that we are not good, the belief that we are a bad person, a bad caregiver, a bad spouse, a bad child. And so and it's very yucky. Shame is a very yucky feeling at times, and it makes us want to hide a lot of the time. What we do understand, though, is that when we speak about these difficult parts of ourselves, is that shame goes away when secrets are told in safe spaces. And so much of the shame, because you're in very difficult positions, in very complex positions as a caregiver, that shame can really show up a lot. And oftentimes it can also really get projected out. Shame can come out in anger. Shame can come out in sadness. Shame can come out in a lot of ways, feeling like you're not good enough, feeling like you're not doing a good job. And so it's recognizing that sometimes shame is lingering around when we don't really realize it. Resentment. And I have anger right under there because they're a little bit different. Okay. Resentment is anger, but it's at the perceived idea of being wrong. And resentment in caregiving situations can be very, very difficult because you have someone that requires care and is dependent on you in some ways, many ways, big ways, small ways, wherever you are in your journey. But there can be a lot of feelings, whether it's a spouse, and it could be resentment of this wasn't how our life was supposed to look. This wasn't what we planned. This isn't how this was supposed to go. How did I end up here? How am I the one that's doing this? And feeling resentment and anger because you feel wrong. The life is wrong. It's unfair. There's unfair feelings there. And then there even can be as a child taking care of a parent, and extra spicy is if there is unresolved baggage, let's say, around the parent-child relationship. If there's trauma there, if there's challenges there, that it's resentment at the parent of, why am I doing this? After everything we've been through, after all of this, why am I doing this? Or even if there's complex relationships with siblings and one parent, like there's so many dynamics here that are at play at all times based on your very individual situation. But resentment can be one that shows up. Anger at yourself, at your loved one, at the whole situation. So this is the difference between resentment and anger is just that, they're different. One is perceived being wrong and one is just anger. It's just like, I'm mad that I'm doing this. I'm mad that you said no. I'm mad, right? And then sadness, just complete sadness at the weight of the situation and for yourself, for them, and for everyone. And now here's the tricky thing about being a human being. You can feel all of these things in one day, over an hour. Like, we are very complex and we move in and out at many different times. You don't just get one emotion a day. We can have lots through the day based on so many things, right? And so there's this idea that we just ride the wave, we let it crest and we let it fall because no emotion lasts forever. But it's very important to remember that we need to recognize where we are at in order to move forward with our skills, which is exactly what I try to say here. It is important to acknowledge, feel, and process these emotions as they can block our ability to emotion coach, practice self-care, and they do increase burnout and reduce empathy. So I'm going to introduce you to one of my favorite little quick things before we get, I think, right into our skill sets, is the 1 degree effect. And I like this because it's more about a perspective taking shift that we can all use. I'm going to get on a plane and I'm very excited for my trip and I'm going to Australia, let's say. And I don't know how planes work, so excuse me for being very incorrect probably, but the idea stands the same. Pilot goes in and he punches in a longitude and a latitude. That's where we're going. And he's 1 degree off, just 1 degree off. Where am I ending up? I am most certainly not ending up in Australia. That's for sure. I am probably ending up somewhere in maybe China. I don't know. But the idea is that the smallest, most what we may consider insignificant change can have a gradual, exponential growth over time. And so to remember and to remind yourself that even if you feel like it's the smallest thing, if it's a breath before you decide to engage with your loved one in a difficult conversation, if it's bringing more laughter into your relationship, if it's just pausing and taking 5 minutes extra for yourself in a day, that over time, that can grow into some really big, beautiful, significant growth. And so do not dismiss small, little changes over time. Okay, so our core skill, what y'all here for today? Why are you even here listening to this person? It's advanced communication skills in the end of it. So emotion and resistance is like an elevator, okay? It's a little bit of a nice metaphor, okay? And emotion is at the top floor, right up here. But we want our loved ones to be practical, listen to us, logic, problem solving, okay? So the door to reason, logic and problem solving, is on the ground floor. So emotion coaching, the skill, is a way to bring that elevator down to the ground floor to be able to open up a person's brain, emotions, resistance to more logic and reason. It is considered an evidence-based strategy to promote cooperation, engagement, and most importantly, flexibility, psychological flexibility. And not doing it didn't lead you here, but doing it can get you out. So why? What is the hope of emotion coaching? Well, again, increase cooperation, avoid de-escalation, avoidance of escalation, sorry, and de-escalation, which sometimes when we're dealing with really big emotions and our loved ones, this can also really help regulate the situation, and it also regulates yourself as well. And then what does it do over time? Well, hopefully over time, it can internalize the self-regulation capacities of both you and your loved one, even with diseases on board that are cognitively challenging, that do increase over time, and we can still internally regulate with this skill. So what is the actual formula? What does it actually do and look like? Well, what it is step one is we're going to validate, which I'm going to teach you how to do, because it's not something that we lean into in society. It is not something that we readily do. And even when we readily do it, we have a lot of social influences that tell us how to undo it very quickly, which I will get into. So what is validation? Well, it's making an effort to convey that you understand their experience. And even if you don't understand their experience or can't even begin to understand what it might be like, it's showing your effort. It's showing that you're trying to say, hey, I'm here. I'm trying to show up for you. I'm trying to get here with you. With 3 because statements, and I'll teach you about that as well and why. And then we have a step 2, which is support. We're going to provide some emotional support, and then we're going to provide some practical support, which is everybody's favorite part, because we want you to do the thing. How we're getting into the emotion coaching thing in the first place is I need you to do the thing. I need you to get in the shower. I need you to get in the car, right? Like that's why we're here. I need to take care of you. I need to care. But when we were met with a lot of resistance, resentment, anger, sadness, apathy on behalf of our loved one, how do we even get them to move and have flexibility? Ideally, this formula is going to give you another skill in your toolbox to try out when those moments come up for you. It's not magic. It's not going to work every time. Sometimes you're going to feel like you're banging your head against the wall, but I will say over time and with practice, you might notice that you will be ahead of it than behind it. What can you validate and support? Well, absolutely anything, to be honest with you. You can validate emotions, sad, mad, shame, loneliness, all of that. You can validate attitudes. Well, why am I even doing this? I give up. This is so stupid. I don't want to do this anymore. Urges, right? Kind of lended that. I said that already. Like, I want to quit. I don't want to go to appointments anymore. Just leaving. Behaviors, disruptive behaviors, aggression. These are all states that we can validate. It doesn't just have to be emotions. Sometimes people get stuck up on like emotion coaching, and so it's only emotions I can validate. No, absolutely not. We can validate all of the things. So I welcome you to put in the chat if you would like, or you are welcome to share as well. I understand that everybody has different feelings about the group, and just offer Elena a moment to pause the recording. I'll go back here.
Okay, I've resumed the recording.
It's really great to know your socially conditioned first impulse. This is so great. Thank you so much for that. We have to know our go-to, which is, reassuring, problem solving, rationalization, and distraction. No, go over here. Look at this thing, or like, let's do this instead. Even asking questions. Well, why? Why do you feel like that? What do you mean? I don't understand. Cheerleading. Yes, you can do it. Come on. I know it. You can do it. Focusing on the bright side. And there's many others in there as well. So let's do one more. And you don't have to pause, Elaine, it'll be fine. But what's another socially conditioned impulse? When I lead the sentence and say, I can understand and imagine that you might feel really, really sad. Just notice what word wants to kind of pop up there. Anyone? It's a 3-letter word. The big old butt. We are so very conditioned to just want to say this word. But if I was to structure that sentence again, I can only imagine how sad you are by having to take care of your dad after everything that you've been through. But you know what? It's really great of you. Does anybody else feel really gross and yucky in their bodies when I just said that? What but does is that it undoes the beginning statement. The beginning statement is really a great, like, validating hook. Like, it's getting in there where it's like, oh, maybe this person really gets what's going on, or I'm feeling it. And then someone says, but, and then it just undoes all of it. And I know that even when I say that myself, I can feel that in my body just going like, ugh, that was really yucky. That did not make me feel good. I don't feel heard. I don't feel seen. I don't feel validated. Yuck. And even maybe possibly cuts me off from even wanting to talk to this person again. So what do? Well, we switch to because. And we try our best to do it 3 times. Even if we get 1 out there, we are ahead of the game by a mile. But if we can do 3, it's even better. Why? Because the first because hooks a person, the second one sinks them a little bit deeper, and then the third one really settles and helps them buy in to how much you've actually really validated them. So I can understand that you would feel very, very frustrated at taking care of your dad because you had a really difficult relationship with him. And because his dementia is really increasing really rapidly, and because you already have so much going on in your life. So how different did that feel versus the other sentence that I structured where I threw in that but? I know that for me and my body, it makes me, because I'm a therapist and we talk about our bodies all the time, but I know that I felt a little bit softer, a little bit more soothed, calmer, and I felt like I could actually get in there with somebody and maybe create an atmosphere where that person could open up. So what are the sentence starters? Here we go. It's a script. It's great. That's why I love emotion coaching, is that it's a script. And I'm more than happy to also share with Elaine after to send you guys. I can send you the script. I can send you the paperwork so that you guys can hold it in your hands. I tell my people, parents, caregivers, it doesn't matter. I'm like, hold the script in your hand. Who cares? You get to be transparent and say, I'm learning a new skill on how to try to connect better and help us both. Use a script. It's great. So some sample sentence starters. I could understand that you blank. I could imagine. No wonder. It would make sense that you are, right? Like, these are all wonderful sentence structure things that we can start with. Validation, a lot of people don't like to validate, right? Because they worry that it's agreeing with a person, or that it's condoning their behavior, or that it's permission, right? And it's actually not that at all. It's just the opportunity to see and to hear and help someone feel seen and heard and show them that you're trying to understand them. That's all. And so why do we do because statements? Because they're rooted in compassion and love and understanding. And they're tentative. That's the other thing that I really like about them, is that you're not making an assumption that you know exactly what's going on. You're trying to figure it out, which also opens up somebody's opportunity to fill the space and say, and even say, well, no, that's not actually how I feel. And then you get to say, please tell me. And then they can tell you. But that is how a conversation is started. It won't fix everything, but it can create space for things to be figured out easier. Okay, so a little exercise, just like a 2-minute exercise. And you don't have to speak, you can just be in your space, and I can ask you to share afterwards. So you can keep the recording going until we move into sharing, if that's something that people would like to do. Okay. So I just want everybody to just, if you feel comfortable wherever you are, just to close your eyes or hold a heavy gaze, whatever it is. But I want you to put yourself in the most resistant state possible. Think about something or do something in your mind that makes you feel very, very resistant, shut down, shut off from the world. And feel it in your body. And just notice what's going to happen. When I tried this one approach, oh, wow. Okay. I can see that you're really shut down. And you're pretty angry. Okay, do you wanna maybe go get something to eat? Like, can you move this along? We have some stuff to do today. I kind of need you, like, I get that you're pissed, and I get that that's what's going on, but, like, we need to go. Okay, I'm just noticing what that did, and then just noticing what this. Okay, I can really imagine that you don't want to go because you're really tired of doing this, and because you're exhausted, you didn't sleep well last night at all, and you can't even imagine getting up. And because I know this week has been really hard and it's been really long and we've fought a fair bit. I can only imagine how much you don't want to go right now. And so taking a big breath in and coming back to the space and just noticing. And if anybody would like to share, we can pause the recording or we can put it in the chat, whatever everybody feels comfortable with. But if there was an opportunity for anybody to share what they noticed about the two different approaches and just what happened for themselves.
Thank you.
So here's the general skill. Step one, we are going to make an effort to convey our understanding their experience and show our effort, which is what you noticed I did. Now what we're going to do is we're going to move in to support, which everybody loves support because it's actually the thing that you wanted to do. It's the cheerleading, it's the reassurance, it's all of that good stuff. It's communication that I believe in you, it's hope, it's togetherness. And then we're moving into practical support, which is problem solving, setting limits, helping them get back on task. So the next separate part of it is basically it's what would you say or do as your first impulse as culturally conditioned member of our Western society in a well-rested, well-fed, positive headspace. Isn't that nice? We'd all love to be there all the time. So that's also why we do that little exercise. It's just to recognize that your first impulse does come in somewhere. We just need to pause, validate first, and then we get to go there. So what does it actually look like? Great. So I can understand that you would feel really sad about having to meet this doctor today because you don't want more bad news, blank, because. Well, it can look like comfort. It can be a hand, a hug, loving words. It can be reassurance of it's going to be okay. And even when it's not going to be okay, it can be, and we've done this before and we can do it again. I believe in you. I believe in just today in this moment. Positive regard. You're doing it. You're doing it. I know you are. Communication of togetherness, of we're in this together. I want the best for you. And even information, like I need to share this with you. There are many different emotional support sentences that we can use that also help us regulate and help us feel like we are also being useful. Because that's also a part that people really struggle with is when we're not feeling useful, when we're feeling helpless. So this is a really great place where we get to kind of get to that feeling. And then practical support. So you put that all together, which is like the 3 because statements, the emotional support, and then the practical support. So why don't we go for a walk instead? Or why don't we just try this one doctor's appointment and then we can do something really nice for yourself today? Or why don't we try to just get in the bathroom? Just the bathroom. You don't even need to get in the bath. Just the bathroom. Let's just walk to the bathroom. Or like, let's just go. Like just structuring it differently. Shared skills can be both of you together. I'll go too. I'll go for lunch too, or I'll come with you. Setting limits, which again, I heard that doing with the psychologist that's coming to speak to you about boundaries, like motion coaching works super well with boundaries. You just can kind of put the validation in prayer. You could still set boundaries. I know that this is hard for you because, and I'm in it with you, and it's still not okay to yell at me. And it's still not okay to slam a door, right? And you can still do all those things. You don't get to set limits because you're motion coaching. It's just in the way and the order that you structure things. Okay, so let's practice. So what I would say is, Elaine, you can pause the recording again because this is the last kind of interactive point. If we'd like. So I'm not taking my meds. And I am imagining that this one is showing up with a lot more kind of like, I'm not taking my meds. So as a caregiver, you could come back and say, I totally get that you don't want to take your meds because you have pill fatigue. You have to do it every day. And because they make you feel really gross. and because you're just exhausted from this process. And I want you to know that I get it, and you're gonna get this done. You're gonna be okay. So let's just start with maybe just one. That's this. I can't live like this anymore. This one's a little bit more hopeless, a little bit more sad, a little bit exhausted. This one, a lot of people might lean away from because it's scary and because it brings up a lot of emotion. But it might look a little bit like something like this. We want to lean into emotion. We don't want to move away from it. We want to lean into it, even if it's yucky, even if it's scary, even if we're worried that we're going to say the wrong thing. So I can't live like this anymore. I can only imagine that you don't want to keep going and that you don't want to live like this anymore because you're in pain and because this is not what you thought your life was going to look like. And because maybe you don't even know if this life is worth living anymore in this way. And I want you to know that I see you and I'm here for you. Maybe we can just get out for a walk today to try to see if that might help. It's a dark and it's a yucky and it's a sad and it's a hopeless place. And yet, if we validate the hopelessness, if we validate the reality of it, we increase connection and we can help with psychological flexibility. Stop treating me like a child, right? This is especially like, yeah, like when it's like either like a spouse or like a parent, but especially as certain diseases really impact their cognitive function and they need a lot of support in some big ways, but they still have that real big autonomy piece. Like I want to do it myself, but it's compromising and can even be very dangerous. So stop treating me like a child. Yep, I totally get that you feel like I'm treating you like a child and you don't want me to do that because you're a grown adult. Absolutely. And because you do believe that you can do it by yourself. And because you don't want to lose your independence, of course. And I want you to know that I still see you as a whole person. You're an adult. I'm just trying to help you because I know that it's hard. So those are some different ways and some different ideas about what that can look like in different scenarios. And remember, practice, practice, practice. It's not going to come easy, right? We're going to want to lean on that butt and we're going to want to just cheerlead and reassure and hope, all fun. But you're going to keep banging your head against a brick wall with your people if you use logic and reassurance and redirection without validation. If you're jumping right into, no, you can do it, it's going to be okay, or can you just take your meds or go to the bathroom? You're going to get a whole different type of emotional response. You are going to be banging your head there against the wall if you keep doing it in that way. So just some practical tips about this. Validation is critical, but it is a two-step process. So don't forget that support. It's a targeted strategy with heart. So we don't want to go around emotion coaching every single conversation that we have with our people, with our loved ones. They'll probably get really irritated and it will lose effectiveness. So we're wanting to use it for those like big moments, right? Those moments where we're really noticing that we need to try our best to increase flexibility, vulnerability, cooperation, all of that. Using tentative language grounded in sincerity, like best guesses, like if you don't know what's going on for them, just throwing some darts at the board and using some best guesses are way more effective than questions, always. Nonverbals are very powerful. Your tone, your body language. So if we're emotion coaching like this, with our body back like this, our people are probably going to be like, I don't really know if she's really that into this, or you seem really angry instead of what's coming out of your mouth. So just be very aware of your nonverbals as well. They are very impactful. And again, you need to practice, your brain will go to default. And most importantly, what if you make mistakes? Well, breaks and repairs lead to a stronger bond, just like muscle fiber and bones. If you make a mistake or a misstep, see it as an opportunity. Just go back. Hey, do you remember when that whole thing that happened this afternoon that did not go the way that I wanted it to? And I said something really mean and I shouldn't have. And what I was thinking about and what I should have said is, I can really understand that you're frustrated because your mobility is changing, because you need to rely on me more, and because you didn't think that this is how this is going to go. So you can always go back. You can repair it. You can circle back. You can always do that. It's not over just because you lost your temper or because you said the wrong thing that you think, or that you feel some shame or guilt around it. It's not what happens. It's what happens next. And right on time. I managed my time effectively today.
Amazing.
So thank you so much. And also just a reminder that thank you from your loved ones for attending here today and being here today for them, and learning and taking the chance to learn something new as a ways to be with them and connect with them and help them. So thank you.
Before I go back to full screen, I just really want to thank you, Chantal, for such lovely, thoughtful, creative, and practical suggestions. I certainly have walked away with a few pieces and thinking about ways of applying them. And so really appreciative of your time. And maybe you can pop or we can talk about this in a moment, but I'll just stop the recording.
Sure.